Afternoon.
Afternoon.
Good afternoon.
We're about to start. I ask that you put your mics on mute and we shall begin. So, in the previous session, we had started to go through the human body and we looked at the axial skeleton. So, we will continue, but we're going to focus now on the appendicular skeleton, right? Everybody, everybody seen the slide?
Yeah.
Yes.
Okay, cool. So the appendicular skeleton is the attachment for the upper extremities and the lower extremities. So that's the shoulder girdle and the pelvic girdle. The appendicular skeleton consists of the arms, legs, their connection points, and the pelvis, right? It includes joints, upper extremities, pelvis, lower extremities. Now, the human body has 206 bones, about 230 joints, and about 640 muscles. We won't be going through all of the joints. That's not a requirement for this course. However, what you need to understand with your joints is that they fall in three classifications. You have joints that have free movement, and that would be like the shoulder joint, the hip joint. You have joints that have limited movement. That would be like the knee joint or the elbow joint. And you have joints that have no movement, right? Example of that would be the pubic symphysis, which is a joint in the pelvic region. It does move. The sutures in the skull, these are joints that do not move. Joints occur wherever bones come in contact, consist of the ends of the bones and the connecting and supporting tissues. Two types of joints that you need to be familiar with for this course. Ball and socket joint allows rotation and bending, and you have your hinge joint, which there is restricted motion, but you can have flexion and extension. Now, the more free movement a joint has, the easier it can be injured. So the more freely a joint can move, the easier the possibility for it to be injured. Upper extremities extend from the shoulder girdle to the fingertips. And the shoulder girdle consists of the clavicle or collarbone, scapula or shoulder blade, and the humerus or funny bone, right? And you have the arms, the forearms, hands, and fingers. So the arm, you have the humerus, and this is a long bone, right? You have the forearm that consists of the radius, which is in line with the thumb, and the ulna, which is in line with the small finger. Then you have the wrist and hand, which you have a ball and socket joint there. Principal bones, you have the carpals that form that's the bones within the hand. You have the metacarpals, that's the bones in the wrist, and you have the phalanges, that's the fingers, the bones in the fingers. so that's the upper extremity, right? The shoulder girdle. Now we look at the lower extremity, right? So the pelvic girdle consists of the pelvis and the lower extremities. Pelvis. Closed bony ring consisting of 3 bones, the sacrum, 2 pelvic bones. Each pelvic bone is formed by fusion of the ilium, ischium, and pubis. And there's a diagram that depicts that. So if you look on the diagram, you can see where the ischium is, you can see where the ilium is up here. And you can see that there are a lot of rich blood vessels that run in that area, right? You can see where the ischial tuberosity is, which is the tailbone, and the acetabulum, which is where the head of the femur fits into the pelvis. And if there is a fracture at the neck of the femur or the proximal end, it is classified as a hip injury or hip fracture. Posteriorly, the ilium, ischium, and pubis bones are joined by the sacrum. Anteriorly, the pubic symphysis is where the right and left pubis are joined, and this is the pubic symphysis. Let's look at the lower extremities now. Main parts are the thigh, the leg, and the foot. Within the thigh or thigh bone, we have the femur, which is the largest long bone in the body. It connects into the acetabulum at the pelvic girdle by a ball and socket joint, and it has a inner and outer portion referred to as the greater and lesser trochanter, right? And this is where major muscles of the thigh will connect to the femur. Then we have the knee, which connects the upper leg to the lower leg, and the kneecap is referred to as the patella. You have the lower leg, which consists of the tibia, which is the shin bone, which is more anterior, and the fibula, which is more lateral. Lateral would mean it's moving away from the midline. At the ankle region, you have a hinge joint, and it allows flexion and extension of the foot. The foot contains 7 tarsal bones, right? So these are the bones. These are the ankle bones. And then you have the bones that form the foot, which are the metatarsals, and the bones found in the toes are referred to as phalanges, just like the fingers, the bones are the fingers. Don't know why I'm thinking respiratory at this point. All right, so that's the structure of the appendicular skeleton. So we have looked at the axial, we have looked at the appendicular skeleton. Let's look a little bit at the physiology, right? And the previous class, most persons knew what the function of the bones were. So the skeletal system gives the body its shape, it protects fragile organs, it allows for movement, it stores calcium, and it helps to create blood cells. Now, the skeletal system works with the muscle, right? So, musculoskeletal system. The musculoskeletal system provides form, upright posture, movement, protection of vital internal organs. And when muscles contract normally, they will produce heat, right? So if that contraction is normal, you'll get heat production. Now, we don't need to know of the 640 muscles, right? Certainly not for this course, but you do need to know that there are three types of muscles. You have your skeletal muscle, your smooth muscle, and your cardiac muscle, right? The skeletal muscle are voluntary muscles, right? These are muscles that require brain, a conscious effort from the brain to move. However, there is a skeletal muscle that has involuntary and voluntary functions, right? So there is one skeletal muscle that has involuntary and voluntary function, and that would be the diaphragm, right? So we can control the diaphragm and we cannot. So it has dual function. That's the skeletal muscle that has both involuntary and voluntary function. Smooth muscles are found within the blood vessels and they are found within the walls of the intestines, right? And then you have your cardiac muscle, as the name suggests, this is the heart. So the heart is actually a muscle, and that's why it is sometimes you will see the term myocardium, myo muscle, right? Heart muscle. Now, this particular slide, pay attention to it. So the muscles that are on this slide are muscles that you would need to be familiar with, especially the muscles in the arm, deltoid, the muscles in the thigh region. These are sites for injection, right? Epi. So make a note of this slide, pay attention to it. Continuing with the musculoskeletal system, physiology, contraction and relaxation of system make it possible to move and manipulate the environment. A byproduct of this movement is heat. So if the muscle contraction is normal, we get heat, right? And for muscle contractions to be normal, oxygen and glucose must be involved. So if there is not enough oxygen involved in the muscle contraction, then you'll get a buildup of lactic acid, right? And that can cause the pH to become more acidic, and that's not good for cells in your body. Another function of the muscles is to protect the structures under them, right? So protection. And that's basically all you would need to know about the skeletal system and the musculoskeletal system. Now, the next system that we're going to look at would be the respiratory system. And this is a very important system, right? Very, very important. So, respiratory system. And we will start by looking at the structure. Start by looking at the structure, right? So the respiratory system is divided into the upper airway structures and the lower airway structures, right? The upper airway consists of the nose, you have the nasal ear passage, which is the mid portion of the nose, and you have the nasal pharynx, which is the posterior portion of the nose. So you have the nose, which is at the anterior, that's the nose. Then you have the nasal passage, which is the mid region. Then you have the nasopharynx, which is the posterior portion of the nose. Then you have the mouth, which is anterior. You have the oral passage, which is the mid portion. And then you have the oral pharynx, which is the posterior portion of the mouth. And then you have the larynx, which is where you have the glottic opening, right? And where you'll find your vocal cords. Now, anything above the larynx would be upper airway. Anything below the larynx is considered to be a part of the lower airway. I'll repeat that. Anything above the larynx is considered to be upper airway structures. Anything below the larynx would be considered lower airway structures, right? Now, above the larynx or glottic opening, you have a structure that is there for protection. That's the epiglottis, right? And the purpose of the epiglottis is to prevent anything that is not air from entering your ear passage and ending up into your lungs, right? So it's there to prevent anything that is not air from entering. That's the purpose of the epiglottis. So that's the structures of the upper airway structures. Now the function of the upper airway is simple. Just remember W, H, F, right? W, H, F, and that's it. So W, the upper airway structures are responsible for warming the air that we breathe in. H, the upper airway structures are responsible for humidifying the air or making it moist, and that's better done through the nose. The upper airway structures is responsible for filtering the air that we're breathing. So it warms, humidifies, and filter. And that function is better carried out when we breathe through our nose than when we breathe through our mouths, right? Now, the other thing that you need to commit to memory for the upper airway, if you look on the diagram, you will see the larynx, you see the oropharynx, and you see the nasopharynx, right? These are posterior areas. So collectively, the nasopharynx, the pharynx, and the larynx are referred to as the pharynx. I'll say that again. Collectively, the nasopharynx, oropharynx, and larynx forms what we would refer to as the pharynx, which is the posterior portion of the upper airway. What does all of this mean? It simply means that there is a connection. And if there is a connection that exists, it means that if fluid is inside the nose, it can end up into the ear passage, right? If fluid is inside the mouth, it can end up into the ear passage, right? And if your patient does not have a patent airway, nothing else matters, right? Airway management is essential when you have a critical patient. No. So that's the upper airway structures. The lower airway structures, so below the larynx, you start to get the trachea forming, right? And there are some cartilage that is found in the trachea, right? And the first cartilage that is in the trachea that you will come across is the thyroid cartilage, right? Or we would call in males the Adam's apple. That's where the thyroid cartilage would be. Now, below the thyroid cartilage, there is a membrane, right? So there's a membrane. It is referred to as the cricothyroid membrane, right? And it is a point area for surgical maneuvers if the airway, the upper airway is significantly compromised. So you have the thyroid cartilage, then you have the cricothyroid membrane. Just below the cricothyroid membrane, you will find the cricoid cartilage. Now, the cricoid cartilage is the first cartilage within the trachea to form a complete ring, right? Now, as the trachea moves down, it forms the bronchus, which divides into the right and left bronchi, right? So you have one that go to the right lung, one that go to the left lung, right? And you have the lungs. And the lungs has a membrane around it, right? So the lungs has a membrane. And that membrane has an inner portion and an outer portion. The inner portion of the membrane is attached directly to the lung tissue. So it's attached directly to the lung tissue. And that is referred to as the visceral pleural. Visceral is associated with organ. So visceral pleural is that portion of the membrane that attaches directly to the lung tissue. The outer portion, right, which is closer to the cavity, the space, that is referred to as the parietal pleural. Now, between the pleural, the visceral pleural, and the parietal pleural, there is some amount of fluid there, and the purpose of the fluid is to prevent friction when the lung tissue expands. The right lung has 3 lobes, the left lung has 2 lobes, and the reason for that is majority of the heart is on the left side, right? Right under the lung tissue, you can see the diaphragm, which is dome shaped or shaped like a dome when it is relaxed, right? And you can see the rib cage and you can see the intercostal muscles between the rib cage, right? Intercostal muscles. So the intercostal muscles and the diaphragm are two very important muscles to breathing, especially the diaphragm. If something is wrong with the diaphragm, the patient will lose the ability to ventilate. Okay. Now, the bronchus forms the right and left bronchi. The bronchi branches into what is referred to as bronchioles, and at the end of the bronchioles, you will find the ear sacs, which are referred to as the alveoli, right? And the alveoli is covered with blood vessels. So there are blood vessels that covers the alveoli, right? That space, this space between the lungs, where the heart and the major blood vessels, and where you would find the esophagus posterior to the trachea, this space is referred to as the mediastinum. Very important space when we move that down in the course, right? Learn it from now. Now, the function of the lower airway. So that was the structures, right? And all of those structures you need to be familiar with. The function of the lower airway is divided into 3 processes, right? I use the abbreviation VOR, VOR to remember it, right? So the lower airway is responsible for receiving air and transporting that air that contains oxygen down to the level of the alveoli, where it will diffuse into the blood that is coming from the right side of the heart, right? And that blood becomes oxygenated and is then returned to the heart and circulated to the rest of the body. Now, in order for that air to move through the lower airway passage and get to where it needs to be, ventilation must occur, oxygenation must occur, respiration must occur. So I am going to pause here for a bit. Now, my question to you, and you can raise your hand and I will acknowledge you. What is ventilation? So that's my first question. What is ventilation? Anybody can answer that question? Y'all know I'm gonna call names if you don't volunteer. Go ahead, Miss Nesbeth.
Ventilation is simply the taking up or the transport of air from the environment and into the airways.
Right. You are correct. You are correct. So when we talk about ventilation, we're talking about the mechanical action of breathing in and out, right? And ventilation has two processes, right? So you have inhalation and exhalation. One of these processes is passive, one is active. Who can tell me which one would be active, which one would be passive? So active means there's a process that requires the muscles to contract, right? Passive would mean it requires the muscles to relax. So which one would be active, inhalation or exhalation? Can someone answer that question? I don't want Miss Nesbeth to answer that one. Somebody else. Let me hear your thoughts. Go for it. Miss Jackson, you there?
Yes, sir.
That question is yours.
Could you repeat the question, please?
Ventilation has two processes, right? Inhalation and exhalation. One of these processes is passive, one is active. Active means it requires muscle use. Passive means it does not. Which one do you think is active and why? No comments? Ron, are you there? Ron? Go ahead.
Yes, sir. I'm here. I understood something about that.
Hold on. Yes, go ahead, Ron. Go ahead.
Okay, so for passive ventilation, then I think passive ventilation should be the process by which you're asking which one use muscles and which one don't, right?
Were you listening to what I was saying earlier?
Could you repeat the question for me, please, sir? So that I don't.
Ventilation has two processes, inhalation and exhalation. One of the processes is passive, one is active. Which one do you think would be active? Which one do you think would be passive?
Inhalation would be active
Why inhalation?
because you're breathing, you're intaking fresh air. So
Okay, you are correct, but you need to know why, right? So you are right. Mute your mic. Mute your mic. Right. You are correct. Inhalation would be active, exhalation would be passive, and you just need to think about it logically. Which one of the process increase the size of the chest? That's when we inhale. So that would be the process that requires muscle use. Which one decrease the size of the chest? Exhalation. So that would require less muscle use. So you need to understand why. You don't need to just know the answer. Now, before I continue, I'll say this much. If at any point I feel that you're not paying attention, then I'm going to make it mandatory that you need to be on cam. Right? So I need your full attention. Ensure that you give that to me. So ventilation was the first question. The other question now is, what is oxygenation? So when we talk about oxygenation, which is the lower airway we're talking about, what is oxygenation, right? Anybody want to try that? Mr. Jennings, you had indicate. So Jennings.
Good afternoon, everybody. How you doing?
Good afternoon.
All right, so basically oxygenation is the process where oxygen is taken up by red blood cells and transported around the body. That's in a nutshell what it is, and
You are
deoxygenation would
correct.
have been the opposite.
You are correct. So that is right, right? So when we talk about oxygenation, we're talking about the ability of the red blood cells, erythrocytes, to bind to the oxygen molecules, right? And the red blood cells require 4 oxygen molecules to be properly oxygenated. It cannot hold more than 4, right? No, so the lower airway is responsible for ventilation, it is responsible for oxygenation, and it is responsible for respiration. So that's the last one. Who can explain the process of respiration? Miss Dennis, what is respiration?
I think, well, the process where the body uses the oxygen to, well, for energy, and then the byproduct of that is carbon dioxide. They pass that back out.
Right, you are correct. You are correct. Right, so when we talk about respiration, we're talking about the exchange of oxygen and carbon dioxide, right? And you have pulmonary respiration and you have cellular respiration, right? So we're talking about gas exchange by the process of diffusion. So yes, we need to understand these 3 processes clearly, because when you have a patient that is having a respiratory problem, that patient can have a ventilation issue, an oxygenation issue, or a respiration issue, right? And we must be able to identify where the problem is in order to determine what the best management would be for the patient. So that's very important, right? So that's a very important Those are very important functions of the lower airway: ventilation, oxygenation, and respiration. Now, if ventilation, oxygenation, and respiration is good, it will ultimately lead to good perfusion. And that's what the body needs. The body needs good perfusion. And when we talk about perfusion, we're talking about the exchange of oxygen and the removal of CO2, right? The exchange of nutrients and the removal of waste from the cells within the body, right? So that they are able to carry out their normal metabolic function, right? So perfusion is the exchange of oxygen and nutrients and the removal of waste and carbon dioxide from the cells within the body so that they can carry out their normal metabolic function. Now, if the cell has oxygen, enough glucose, it is referred to as aerobic metabolism. It means oxygen was involved, right? If there is not enough oxygen, it is referred to as anaerobic metabolism. That means less energy is produced. That's not good for the cells, right? Let us continue. All right, so upper airway, and I'm just reviewing now, includes the nose, mouth, oral cavity, tongue, jaw, mandible. Larynx divides the upper and lower airway. You have the pharynx, which consists of the nasopharynx, oropharynx, and laryngopharynx, right? You have the trachea, you have the epiglottis, right? And the epiglottis prevents anything that is not air from entering the trachea. The esophagus is a part of the lower airway, and it runs, well, it runs posterior to the trachea. The trachea consists of the thyroid cartilage, right? In layman's term, Adam's apple. It is V-shaped. It is open at the posterior end, right? Below the thyroid cartilage, there is a membrane. That membrane is referred to as the cricothyroid membrane, right? As I say, it's a landmark for surgical procedures. Below the cricothyroid membrane, go ahead, Ms. Nesbeth.
Understanding exactly where, when I try to locate the cricothyroid cartilage, which they say is a depression, and the thyroid cartilage, it's kind of difficult.
All right. So put your, let me go on cam, even though I don't want to, but I'll go on cam. All right, can you see me? Are you able to see me?
No, sir.
Seeing me now?
Oh, yeah.
All right. So you're gonna put your finger on your chin, right? Your index finger on your chin, and run it down to your neck until you feel a rigid structure, right? The first structure that you feel right there, that's the thyroid cartilage. It moves when you speak, right? Now, if you locate where the thyroid cartilage is, if you put your finger below that, you'll feel a soft portion, right? That's the cricothyroid membrane. And then just below the cricothyroid membrane, you will have the cricoid cartilage, right? That's the position of those structures. I hope that helped. Off cam. All right. The trachea ends at the carina. That's where it bifurcates into the right and left bronchi, leading to bronchioles. Lungs. The two lungs are held in place by the trachea, arteries and veins, pulmonary ligaments, divided into lobes. Now, the right lung has the upper, middle, and lower lobes. The left lung only has upper and lower lobes. And remember the membrane around the lung tissue. And there's an inner portion and an outer portion, right? Visceral pleura and parietal pleura. Within the lobes are bronchi, and then the bronchi branch into bronchioles, and then we have the alveoli, which is the ear sac, right? And the alveoli is lined with a substance referred to as surfactant. Think about surfactant as soap sud, right? Now, the purpose of the surfactant is to allow the alveoli or ear sacs to have elasticity. So when we breathe in and out, they don't completely close up, right? Right, and this diagram depicts it quite nicely. So you have the thyroid cartilage up here in the middle, cricothyroid membrane, which is a surgical area for invasive airway management, and then you have the cricoid cartilage. All right, now muscles of breathing. Diaphragm, intercostal muscles are the primary muscles of breathing, right? Very important muscles, especially the diaphragm. Also involved are the neck, cervical muscles, abdominal muscles, and pectoral muscles, right? Now, in normal breathing, for your adult patients, you shouldn't be seeing them using muscles in their neck or abdominal region to breathe, right? And you shouldn't be seeing retractions of the muscles in the chest. That's a bad sign. So if breathing is normal, there shouldn't be any visible muscle use. If you can see muscle use, something is wrong. And if something is wrong with the patient's breathing, you need to fix it, right? If you don't have an airway, nothing else matters. All right, now respiratory system physiology. Function is to provide the body with oxygen and eliminate carbon dioxide. Ventilation and respiration are two separate interdependent functions of the respiratory system. Respiration is the exchange of oxygen and carbon dioxide in the alveoli and tissues, right? So you can have pulmonary respiration and cellular respiration. It provides oxygen to the cells and removes waste, carbon dioxide, and the exchange occurs via diffusion. So this is the passive process. It's a passive process in which oxygen molecules will move from areas with higher concentration of oxygen molecules to areas of low oxygen concentration, right? And then you have a very important structure, the brainstem, right? And the smallest portion of the brain, and it's a very important area of the brain because it controls life-sustaining functions, right? So the brainstem controls our ability to breathe, right? Now, within the brainstem, you have the medulla and the pons. The medulla initiates ventilation cycles, right? Which would be stimulated by elevated level of carbon dioxide, right? And the pons has two areas that will help to augment respiration during emotional or physical stress. So it can increase the strength. Ventilation is simple air movement into and out of the lungs. It requires chest rise and fall, right? And with that chest rise and fall, we must get what is referred to as adequate tidal volume, right? So tidal volume is the amount of air that we breathe in and out in one breath, right? Now there are numbers attached to it, but in the field as EMS providers, we can't measure that. So what do you need to look at? How am I going to know if a patient has good ventilation? Anybody can answer that question? If I have a patient in front of me, how would I know if this patient's ventilation is adequate?
Watch the rise and fall of the chest.
Thank you very much. We look at the patient's chest rise. Cool. Residual volume. The gas that remains in the lungs to keep the lungs open. So we cannot completely empty the lung. What does that mean? It means that when we breathe in, not all the oxygen that we breathe in is going into the blood, right? So there is a cutoff point. Right? So we have something that is referred to as dead space. Now, dead space is anywhere within the respiratory tract, whether it's upper or lower airway, that the exchange of gas cannot occur, right? So gas exchange would occur primarily or mostly in the alveoli or ear sacs, right? Anywhere outside the respiratory tract where the exchange of gas cannot occur is referred to as dead space. So it means that as normal adults with no breathing issues, we have dead space, right? It's something that every person have, dead space. Now, if a patient starts to have serious issues with their ability to ventilate, right? If they start to have serious problems with their ability to ventilate, then the dead space will expand, right? And if you have dead space expanding, it means that it's going to be difficult for that patient to get oxygen to the alveoli, right? So this is a patient that we would need to breathe for, right? So anytime a patient's dead space start to increase physiologically, we need to breathe for the patient. In other words, in layman terms, if you can barely see the patient chest rise or no chest rise, you need to breathe for the patient, right? Now, the respiratory rate times the tidal volume, and you may have to subtract the dead space, would give you the minute volume. So that's the amount of air that the patient can move in and out of the lungs in 1 minute. Always evaluate the amount of air being moved with each breath when assessing a patient's respiration, right? All right, so the characteristics of breathing. So anytime you are going to assess a patient's breathing, everything that is on this slide, You need to think about it and you need to do it, right? So this is where we start to lose patience, because when we're assessing the patient, there's a tendency and a bad practice, especially in these young EMS providers these days, to shortcut the management, right? No, one of the most common guest vital sign is respiratory rate, right? Well, a lot of people love to make up that respiratory rate. So the characteristics of normal breathing are as follows. You ascertain a normal rate and depth, right? So you need to look at how fast or slow the patient is breathing per minute, right? And an adult, you're looking at 12 to 20 breaths per minute. The younger the patient, the faster the patient is going to breathe, right? You need to look at the chest rise. So the patient is breathing. Is the patient breathing within a normal rate? Can I see visible chest rise, right? Is it consistent? That would be regular rhythm or pattern of inhalation and exhalation. Do I see consistency, right? And do I see it on both sides of the patient's chest, right? The other one, the point after that is another area where we tend to fall down in as well, right? So we guess the respiratory rate and we don't listen to the lungs. If a patient is having a breathing issue, you need to listen to the patient lungs. Remember what I said earlier. The lower airway is responsible for ventilation. We look for ventilation via chest rise, right? So we look at chest rise to determine if ventilation is adequate. The lower airway is responsible for oxygenation. We use a pulse ox to determine that, and the patient skin color, right? Specifically the mucous membranes, right? The lower airway is responsible for respiration. This is where we will use our stats or stethoscope to listen to the patient lung sounds, right? That's how you're gonna know if a patient is having good respiration, right? And you can look at the skin as well. Now, the point is this. When we listen to a patient lung sounds, we are trying to determine if the patient needs more than oxygen. Because when a patient have a breathing problem, they're going to need oxygen. The question is, how do they need this oxygen? Do we need to create ventilation for the patient? Do we need to supplement oxygenation for the patient? Or do we need to clear the patient's alveoli because fluid is inside of it, right? So it is very, very important that if a patient's primary issue is a breathing problem, you listen to the patient's lungs, right? So look for regular rise and fall, movement on both sides of the chest, right? And look for movement of the abdomen. So you can see movement of the abdomen in a pediatric population, and that is considered normal. This is a very important slide. These are the characteristics of breathing, normal breathing. So when you are assessing a patient, I expect to see all of this coming out in your assessment of the breathing. Now, if you know what is considered normal breathing, it means that anything outside of that would be abnormal. So looking at this slide now, what would be abnormal breathing? Let me hear your thoughts.
Only one side of the chest rises,
Right?
or breathing rate, respiration rate less than 12 or more than 20.
Right. Miss Jackson?
It will be abnormal if when you listen to the patient's lungs, it's not clear.
Right? Good. Anybody else want to add anything for participation points? Yes, Miss Johnson. Go ahead.
If there is depression above the clavicle, 'cause when somebody has an asthma attack,
Right,
then it usually sinks in, so we know that there is abnormal breathing.
right. So that would be considered labored. That's abnormal muscle use. Yes, you are correct. Good. So yes, Miss Nesbitt, go.
Times too, like when a person has like pneumonia, you'd hear crackles when you examine
Right? You're
the
gonna
lungs.
you can hear crackles, which can be fine or coarse, right? Depending on whether it's fluid or pus. You people are sharp, man. And razor sharp. All right. So inadequate breathing pattern in adults. You're looking for labored breathing, and that's what Miss Johnson was describing. So you're seeing the muscles being used. And if you see a patient using muscles when they are exhaling, they are in serious trouble, right? So if a patient is working very hard to breathe out, they are in trouble because that is a passive process. They should not be working that hard. That patient is in serious trouble, right? You're looking for muscle retractions. That's when the muscle pulls in, right, around the ribs. You're looking for changes in the skin color. Is the patient pale? And when you see pale skin, it indicates that the blood vessels have constricted, right? So they have gotten small. That's what pale skin indicates. And you will see pale skin before you see cyanotic skin. Cyanotic would be bluish coloration, bluish discoloration of the skin, which indicates poor oxygenation. If you can see cyanosis and it is central, your patient not in good shape, right? Cool damp skin, which would indicate that blood flow is being redirected from the skin to the core of the body. That's when the patient starts to go into shock, something you will learn about later on. The tripod position, which the patient is basically leaning forward with the hands on the leg or the hands on a table or something, and you can see them working hard to breathe, right? That's tripod position. And you can see agonal gasps. Now, agonal gasps or gasping breathing is not considered breathing. So if you see agonal gasp, you treat it as if the patient is not breathing, right? These are the things that we would look for in inadequate breathing. All right, and that will be the end of the respiratory system. Any questions? No? No questions? Dennis, Miss Dennis, we good?
Yes.
Come back to the mic. Okay, good. Miss Johnson, how we doing? We okay?
So
Come
far,
to the mic. Okay. Miss Nesbitt,
so far.
Mr. Jennings, Mr. Jennings. Okay. Ron,
Sir.
yes, go
Yes,
ahead.
sir. All right. So question. If a patient breathing is normal, so if the patient has all the good characteristics of breathing, but the patient is experiencing tightening of the chest, and the patient is exclaiming that he or she is experiencing that. What could be the possible cause?
Patient can be experiencing tightness of the chest and the characteristics of breathing are normal. You're gonna see something that has changed. So if the patient is really having tightness of the chest, it would indicate that the air passage is closing up. If the air passage is closing up, it means that the patient might be able to get air into the lungs, but when they're getting air out, because the air passage is so narrow, it's going to cause problems. So you might not hear clear lung sounds, or you might hear wheezing, right? So the patient can have chest tightness and there is a physiological issue and it doesn't show as signs and symptoms. They would be lying if you don't see anything for that patient, right? Something is going to change in their presentation. Any other question?
No, sir.
All right. Okay. The next system is the circulatory system, right? There is more to the respiratory, but I'm taking it slow, right? I think you guys need to learn to creep first, then walk, then run. So I'm taking it very slow, but there are some other things that we need to learn about the respiratory system as it relates to the primary stimulus for breathing and the hypoxic drive, right? But we'll go into that when we cover airway management. Now, the heart, or circulatory system, I should say, excuse me. Circulatory system is a closed network, right? It consists of the blood vessels, the heart, which is the pump, the blood vessels, which is the pipe, and the blood, which is the fluid, right? Now, the blood is composed of your white cells. Okay, Mr. Jennings, no problem. Understood. The blood consists of white blood cells, that's your leukocytes, red blood cells, erythrocytes, plasma, and platelets, right? The red blood cells is responsible for the process of oxygenation. So red blood cells have a very important role to play with the process of oxygenation. The leukocytes or white blood cells are responsible for fighting infectious conditions within the body, right? Or infectious microorganisms within the body. Platelets are important to clotting, the process of clotting. And the plasma is the fluid portion of the blood, right? And then you have the pipes. Now, in order to understand the circulatory system very well, we must understand how the pipes work, right? So you have arteries, arterioles, capillaries, venules, and veins. These are the pipes. So you need to understand how the pipes work. So these are things that you need to commit to memory. The aorta, so we're talking about the arteries first. The aorta is the largest artery in the body, the aorta, right? The arterioles are the smallest arteries in the body. The arteries primarily carry blood. So the arteries carry blood away from the heart, and use that A in arteries for away. Arteries carry blood away from the heart. So the aorta is the largest artery, the arterioles are the smallest, and the arteries carry blood away from the heart. A is for away. The arteries primarily carry oxygenated blood. So arteries primarily carry oxygenated blood, with the exception of the pulmonary arteries, right? And we have two pulmonary arteries. The pulmonary arteries carry deoxygenated blood to the lungs. So the pulmonary arteries carry deoxygenated blood. All the other arteries carry oxygenated blood. The other thing that you need to remember about your arteries is that arteries are high pressure vessels. Arteries are high pressure vessels. Very important point, right? So let's recap again. The aorta is the largest artery in the body. Arterioles, smallest. Arteries carry blood away from the heart. A is for away. The arteries primarily carry oxygenated, Arteries primarily carry oxygenated blood, with the exception of the pulmonary arteries, which carry deoxygenated blood from the heart to the lungs. So that's the arteries. Then we have the veins, right? Now the vena cava is the largest veins in the body. The venules are the smallest veins. Veins carry blood primarily towards the heart, and the veins have valves inside of them to prevent backflow, right? Veins are low pressure vessels. So veins are low pressure vessels, right? So let me repeat that again. The vena cava is the largest veins in the body. Venules are the smallest. Veins primarily carry blood towards the heart. So they carry blood towards the heart, right? And they have valves inside of them to prevent backflow of blood. Now the veins primarily transport deoxygenated blood. So the veins primarily transport deoxygenated blood, with the exception of the pulmonary veins. And we have 4 pulmonary veins. And the purpose of the pulmonary veins is to transport oxygenated blood from the lungs to the left side of the heart. That would be the left atrium, right? That's the veins, and that's the arteries. Now the capillaries. The capillaries are the smallest blood vessels in the body, right? The capillaries are the smallest blood vessels in the body. And the capillaries are the connections between the arterioles and the venules. So the capillaries is the connection between the smallest arteries in the body and the smallest veins in the body, right? At the level of the capillary, it is one cell at a time. That is how the cells move within the capillary. One cell at a time, right? Now, everything that I have mentioned so far about the blood vessels are things that you must know. You must understand that about the blood vessels. If you do not, then you will get confused when you try to follow the circulation of blood through the heart. So you must know the blood vessels, okay? Now, within the circulatory system, you have the systemic circulation, which is the circulation from the heart to the body and back to the heart. So systemic is circulation from the heart to the body and back to the heart. Pulmonary circulation is circulation from the heart to the lungs and back to the heart, right? Now the circulatory system is responsible for circulating blood within the body, right? That's the main function, to circulate blood within the body, right? And the blood will have what the cells in the body require, right? Oxygen, nutrients, the cells pick that up, remove the waste, carbon dioxide, right? And we get normal, good perfusion. Now, I will pause here for the circulatory system. Is there any questions?
Sir, could you touch back on the capillaries, please?
Okay. All right. So the capillaries are the smallest blood vessels in the body. Smallest blood vessels. Excuse me. Let me just sip a little water for a second. Right. So capillaries are the smallest blood vessels in the body, right? The capillaries are the connections between the smallest arteries, which would be the arterioles, and the smallest veins, which would be the venules. At the level of the capillary, it is one cell at a time. So one cell at a time will pass through the capillary. You can't have more than one. If you have more than one cell passing at the level of the capillary, you can get increased pressure inside of the capillary, and that can start to push fluid out, right, to where it shouldn't be. So that's the capillaries, right? So this is the first portion of the circulatory system. We have not touched the heart as yet, right? Now, what was that? Yes, we have not touched the heart as yet. And we're not going to go into the heart today. Definitely not going into the heart right now. That would be for next class, right? So I'm going to pause here for today, and let's handle some housekeeping matters. So anybody has received their access yet to the platform?
No, I haven't.
I tried it today but didn't get through.